Good afternoon, Ms. Polanco. My name is Isidora Sanchez, and together with my classmates Catalina Peña and Kimberly Bustos, we will talk about obsessive-compulsive disorder. So, according to the National Institute of Mental Health, OCD or obsessive-compulsive disorder is a mental illness that is characterized by the presence of recurrent thoughts, which are called obsessions, and the need to perform certain actions repeatedly, and these are referred to as compulsions. So, an obsessive thought or obsession can cause anxiety and distress to a person. This leads to a compulsive behavior or compulsion, which is an action that the person does in order to reduce the anxiety that the obsession caused. But sadly, the relief is temporary and the cycle is repeated. So people who suffer from this illness feel like they cannot control themselves at all, even if it interferes with their daily lives. A very common obsession of people with OCD is that they think they may have left the door of their houses unlocked, and even if they're almost 100% sure that they locked it before leaving, the mere thought of someone maybe breaking into their houses becomes unbearable, and they have to go back and check, and this can happen multiple times, even in the same day. OCD is also part of the anxiety disorder spectrum, which is a group of mental illnesses that are characterized by the feelings of fear and anxiety, obviously. And here we also find agoraphobia, PTSD, social anxiety, generalized anxiety, panic disorder, separation anxiety, selective mutism, and all the specific phobias that exist. The causes for this illness are unknown, but scientific theories include genetic factors like having someone else in your family with a mental illness, environmental factors like poverty or a history of child abuse, and abnormalities in the structure of the brain, so parts of the brain may not respond well to serotonin. In the statistics, we have that half of the people start to develop symptoms before turning 20, and after 30, it's very uncommon for this illness to appear for the first time. OCD is more common in women than men, with rates of 1.8% for women and 0.5% for men. 90% of people who suffer from this illness have another existing mental health condition. So, for example, 75.8% have anxiety, 18.8% have ADHD, 40.7% have depression, and 23.4% have bipolar disorder. So the rates are pretty high in comparison with the comorbidity of other mental illnesses. And sadly, more than 50% experience suicidal tendencies, and 15% have already attempted suicide. These are all statistics provided by the Recovery Village. The common treatment for this illness in the psychiatric field is a combination of drug therapy and cognitive behavioral therapy, or CBT. With drug therapy, the physician will start the patient on SSRIs, or selective serotonin reuptake inhibitors, which are drugs that work by increasing the levels of serotonin in the brain. And with CBT, the specific name of the type of therapy that is used for OCD is called exposure and response prevention. So the patient will be exposed to what triggers their obsession while trying to avoid doing the compulsion. And with this kind of treatment, 10% of people experience a full recovery and 50% experience an improvement in symptoms.